Why do bone cancer blood test markers change before scans? Imagine your body as a busy city where signals are constantly sent and received. When bone cancer starts to develop, it triggers changes at a biochemical level long before any visible signs appear on scans. Blood test markers related to bone cancer can shift because they reflected these early biological activities. Substances like alkaline phosphatase, especially the bone-specific form, and lactate dehydrogenase are enzymes and proteins produced or released when bone tissue is affected. These markers can fluctuate as cancer cells influence bone cells, causing either increased breakdown or formation of bone. For example, when cancer stimulates osteoblasts, the cells responsible for building new bone, alkaline phosphatase levels in the blood tend to rise. Conversely, if the cancer causes bone destruction, calcium can leak into the bloodstream, leading to higher calcium levels, a condition known as hypercalcemia. These biochemical changes happen because the body responds to the abnormal activity in the bones, releasing enzymes and minerals into the blood. This process occurs before the physical changes in bone structure become visible on imaging scans like X-rays, CT scans, or magnetic resonance imaging. Tumor markers, which are substances produced by cancer cells or by the body in response to cancer, can also increase in the blood before any tumor mass is detectable on scans. However, these markers are not specific only to bone cancer and can be influenced by other conditions such as healing fractures, growth spurts in children, or other bone diseases. The main reason blood markers change earlier is that they are sensitive to the biochemical activity happening at the cellular level. This activity includes increased bone turnover, which releases enzymes and minerals into the blood. Blood tests can pick up these subtle shifts because they are designed to measure enzyme levels or other biochemical substances, which can change quickly. Imaging scans, on the other hand, detect physical changes in bone structure or tumor size, which often lag behind the biochemical signals. Because of this, doctors often use blood tests alongside imaging to get a clearer picture of how the disease is progressing or responding to treatment. If blood markers start to rise, it might prompt earlier scans or adjustments in treatment even if the scans do not yet show visible changes. In summary, blood test markers change before scans because they reflected early metabolic and biochemical alterations caused by cancer in the bone tissue. These changes happen at a cellular level first, signaling that something is happening beneath the surface. Blood tests are a helpful tool for monitoring bone cancer activity, but they are used together with scans and clinical evaluations to provide the most accurate picture of the disease. Always remember that individual cases vary, and it is essential to consult healthcare professionals for personalized advice and diagnosis.